Hello, my name is Siobhan McMullen and I'm an occupational therapist. Occupational therapy, also known as OT, focuses on promoting independence in activities of daily living to enable people to live independent and fulfilled lives. In stroke rehabilitation, our role is to support patients to regain independent living skills, which may have been affected since the stroke. Our support often starts when the person is first admitted into the hospital, and we may be involved throughout their inpatient stay, as well as when the person is discharged back out into the community. Stroke can present in many different ways, and an occupational therapist will assess how the stroke has affected the person and then consider how it's impacted on their activities of daily living. From the stroke, a person may have weakness on one side of their body, and so they may be unable to walk or use their arm to pick up items. They may be unable to concentrate for periods of time and become distracted. They may be unable to understand language, or it could be a combination of these things. There are also several other deficits which may occur as a result of the stroke, such as visual problems or psychological difficulties, and these can all affect how a person carries out their activities of daily living. An OT will complete an assessment looking at all of these possible factors and explore exactly how they impact on activities of daily living. An OT may use more paper-based assessments, but we may also assess a person in their daily routine, such as reviewing the person in their morning routine of getting out of bed and getting washed and dressed. Within the assessment, it's really important that the OT has an understanding of what is important and what life is normally like for the person, and the assessment will be shaped around this. For example, it may be that the person usually showers in the morning rather than strip washing on the ward. An OT will therefore assess the person in the most relevant way and what is reflective of the person's usual life. It may be that the person who has had the stroke is unable to communicate what is important to them or what life is usually like. And if this is the case, the OT will jointly work with the person and the family to get a true picture of this. Following the assessment, the OT should have an idea on how the stroke has affected the person, how it has affected their ability to manage daily life, and what they would like to be able to get back into doing. The OT will then jointly come up with a specific goal plan, which is realistic and important to the patient. The goals may need to be broken down into smaller steps that are manageable for the person, and these goals are reviewed frequently to ensure they are still relevant and realistic. For some patients, their initial goal might be to be able to sit out of bed or to be able to feed themselves. For others, it may be to shower and dress themselves or to be able to make their breakfast. This depends on the person and to what extent the stroke has affected them. When the occupational therapist has a good idea of how the stroke has affected the person and what the person would like to be able to do again in their daily life, OT rehabilitation begins. An OT will engage the person in the rehabilitation process by practicing the activity or breaking down elements of the task to improve their independence. For example, an OT may use shower and dressing practice as part of a rehab program or specific upper limb rehab to address picking up items such as a cup. An OT will work with the stroke patient to regain their own independence, but we can also look at strategies or equipment which could aid this. These could include referrals on for equipment, home adaptations such as grab rails. An OT may also recommend short or long-term care packages based on how a person manages with activities of daily living. Sometimes a person may need more intensive input when they're discharged home, such as that from a nursing home. An OT can provide guidance on this jointly with other multidisciplinary team members. As occupational therapists, we can be involved throughout a person's journey following stroke to promote as much independence in daily life as possible. Ensuring quality of life after stroke is important. If a person feels that they are unable to manage life like they used to, we can work jointly with that person to look at strategies to help them return to independence and make the most out of their life after stroke.